The election takes center stage today. It's important to remember we're still in the middle of a global pandemic.
Many people showing up to the polls today have some concerns about COVID-19 while standing in line. So joining us today to talk about that and other coronavirus topics is Dr. Jeff Pothof, the Chief Quality Officer at UW Health. Dr. Pothof, good to see you.
Good to see you again.
Yeah, good to be on the show again.
It seems like the majority of people voted early, but for those who have to go to the polls today, I did it myself this morning. Is it safe to do that, given where Wisconsin is with the pandemic?
You know, we know a lot more about the virus right now than we did this spring. And, you know, going to the polls in person does create a bit of risk for you. But for the most part, it can be mitigated, probably down to the level of going to a grocery store or going to Home Depot.
So masks are not required in the polling places, but it's still probably a good idea to wear one.
Yeah, from the public health perspective, we absolutely want to see everyone with a mask at a polling location. We know that masks are effective. That data is really sound. We also want to see physical distancing. You know, a lot of the polling places, they know that. They've set that up for you. The one place to keep an eye on it is really when you're in line waiting to vote outside. Just be mindful what 6 feet is. Try not to crowd that. Those are the two big recommendations. And then, you know, bring some hand sanitizer. There's a lot of shared items in a polling place. Every time you touch something that's shared, just go ahead and give yourself a little squirt of hand sanitizer. Get any possible virus off your hands.
And shout out to the poll workers. They really have been on top of it. They've worked very hard to keep everyone safe. But cases in Wisconsin continue to spike. We reached nearly 6,000 today. Why is that still happening in our state?
Yeah, you know, it's such a problem for us right now. We're really having a hard time as a state getting control of this. And, you know, I think there's a couple factors, but two of the big ones. One, we're just getting tired of mitigation efforts. You know, we've been doing this for a long time. I think a lot of people are saying, you know what, I'm just kind of fed up with social distancing. I'm kind of fed up with the mask thing. And they start looking for information that helps them determine what risk they're taking on if they start to ignore people like myself or other public health experts who say, you know what, wear a mask and socially distance. And unfortunately, we have a lot of misinformation out there. You can find one person saying, you know what, this virus is really dangerous. We're in a really bad time right now. We really got to buckle down. But you'll find someone else who's a leader who will say, you know what, this isn't much different than the flu. I don't think it's very dangerous. And I think people are making a risk calculation that actually is incorrect. And they take on risk that they don't realize they're taking on. And, you know, with decreased compliance with masking and distancing, we're just sure to see increased cases, increased hospitalization, increased deaths. So I think that's part of the problem that's going on right now.
And Wisconsin is not unique in that fact, is it?
I think, you know, maybe not unique, but I do think that Wisconsin has had maybe more mixed messaging and kind of a less, you know, statewide approach, you know, large region approach, which allows people or lends people to trying to make the decision on their own. And that is proven to be a pretty difficult thing to do and not an effective way to fight a pandemic.
What is the hospitalization situation at UW Hospital?
Yeah, we've definitely dusted off our progressive plan that we made in the spring that helps us identify, you know, what spaces can we make appropriate for COVID patients? How do we staff them? Do we have the right supplies? We've begun turning down some of our non-urgent procedures because we have to make room for all the COVID volume that we're seeing right now. So, you know, not a great situation. We're stretched really thin, not only at UW Health, but also at Meriter. And SSM, I feel, is also stretched thin. So, you know, we have contingency plans, but it'd be better if we didn't have to use these things.
Yeah, it's not getting better on its own, that's for sure. We have to take a hold of this and get out and vote tonight. Maybe unpoliticize this virus a little bit after the election. Doctor, thanks for being with us today.
You betcha.
Great to see you, Dr. Pothof. Thank you for your time.